All right.
Hello, Mark Anthony here. I'm with Miss Melody Prettyman. She does cooking shows all over the country as well as doing cooking shows on 3ABN all the time. And so we're just sitting here visiting over in Chattanooga, Tennessee, and thought we'd let her give you a little health message all about, what do you want to talk about? Diabetes maybe? Or
diabetes is a good one because the seminar that I just did, I really had more people in the seminar that were really struggling with type 2 diabetes. And the information that they have and the information that I gave them was so different. And they didn't understand, about these carbohydrates and what causes diabetes. They think it's just basically sugar that causes it, and that's not true, Mark. Mm-hmm. It's from a high-fat, high-refined diet.
Okay.
And the doctors will give them their insulin, and they go about their business, and then pretty soon they have to have more insulin, or they have to have more pills, and they still have type 2 diabetes.
Huh.
And that's a lifestyle disease. They weren't born with it.
Yeah, and I always thought it was the full-blown sugar aspect.
A lot of people do. They think it's because
and
they
the
ate
overweight.
too much.
Yeah.
Absolutely. It all has a factor in it. It all plays together. But the problem of it is the diet that the doctor might tell them that they need to be on, like eliminate a potato. Uh-huh. But you can allow for your dessert. And it's making it so hard for these people because they have no idea what to do. And then when I come and give them the information, and they struggle a little bit, like, what am I going to eat now? Because I had one lady in particular, blessed, loving lady, and she was so confused because when we got to talking about the diet that was best for her versus this diet that she was on now, where they told her they were going to increase her insulin now, again. She had to go home and throw everything away. Oh.
So what, in just a minute or two, what is the best thing that somebody could do to help treat type 2 diabetes?
Absolutely. The first thing they need to do is add more vegetables to their diet. The main ingredient is, especially your leafy green vegetables. And you can't get too many of them. Fruits, fresh fruits, not dried fruits, not canned fruits, but the way God gave them to us, because it doesn't peak the insulin levels. Our bodies know how to
like
handle
the canned
them.
fruits do. Those
Absolutely.
peak. Okay, got it.
And you can eat how many apricots? 3 maybe? 3 regular ones? They're small.
I barely eat one.
Well, they're so good for you. But what I'm saying is, if you take dried apricots, you could eat half a pound of them.
Yeah.
And you're getting a high concentration.
Right.
Of that sugar, and they've already got.
And that's a weight gain then. Would that
it's
be
a weight gain as too.
Okay.
But these are the things they need to pay attention to. Whole grains. A lot of people will eat white rice. We don't want white rice. We want whole grain rice, brown rice, basmati rice. Mm-hmm. We want oatmeal. Another problem I find is they say, I'm supposed to have oatmeal, but they get to looking at the nutritional fact panel, they find out their oatmeal has sugar, sodium, and more sugar in it. So we need, like oats, just plain oats. Nothing
steel cut.
Steel cut.
I like those. Mm-hmm.
Oat groats.
All right.
But, your beans, your tubers are okay. We just need to leave off those refined foods.
Good to know. Hey, we're just sitting here setting up for tonight's show over in Chattanooga, Tennessee, and then we'll get a couple more clips, and just keep tuning in because we're going to constantly be giving you health messages that are going to change your life. Mark Anthony signing out.